Hello, and welcome to this National MS Education Awareness Month teleconference hosted by MS Focus, the Multiple Sclerosis Foundation, and made possible with support from Mylan, Genentech, Bristol Myers Squibb, Biogen, EMD Serrano, Novartis, Sanofi Genzyme, and Janssen Neuroscience, a Johnson & Johnson company. I'm your host, Chris Payne, editor at MS Focus, and I'm joined by Dr. Rosalind Kalb, who will be talking to us about how to work effectively with your care partner. There are slides accompanying this presentation. To view the slides, please connect to the conference online at join.freeconferencecall.com/msfocus. Now, let me introduce our speaker. Dr. Rosalind Kalb is a clinical psychologist who has specialized in MS care and education for close to 40 years. After receiving her doctorate from Fordham University in 1977, she began her career in MS, providing individual, group, and family therapy at the Medical Rehabilitation Research and Training Center for MS at the Albert Einstein College of Medicine, and then at the MS Comprehensive Care Center in White Plains, New York. She is the senior author of Multiple Sclerosis for Dummies, second edition, and co-author of Multiple Sclerosis, Understanding the Cognitive Challenges. In addition, Dr. Kalb has edited 2 books, Multiple Sclerosis, The Questions You Have, The Answers You Need, now in its 5th edition, and Multiple Sclerosis, A Guide for Families, now in its 3rd edition. We're pleased to have her join us to present this important topic. Dr. Kalb, thank you for being with us, and now I turn it over to you.
Thanks very much, Chris. I'm very happy to be here. You can go on to the next slide, please. I'm very sorry that we can't see each other for a couple of reasons. I always enjoy it more when I can see the people I'm talking to, but also in the crisis we're living in right now, being able to see one another and connect is even more important than it usually is. So today I'm going to talk about care partnerships, but I'm also going to kind of weave in some special thoughts about this unique time we're living in right now, because all of our partnerships are under additional stress and strain as we deal with COVID-19. Can you go on to the next slide, please, Chris? So what I'm hoping to accomplish with you today is to help you recognize the many forms that our partnerships take. And that when the call is over, you'll be able to describe what a healthy, satisfying partnership is that works for both of you, and come away with some tips for helping to keep your partnership balanced and satisfying, even as MS may change over time, or as there are world issues like we're dealing with today. And also to learn ways to build connections and find support if you find yourself without those close partnerships in your life at the present time. So we have all kinds of care partners in our lives, right? We have spouses and partners. They're the most obvious ones that come to mind. But folks who are living with MS also may have parents who are supporting them. Or you may be a young adult who is supporting an older parent with MS. You may also have a very close partnership with a sibling who provides comfort, support, assistance to you in your life. And of course, friends or a neighbor. I think what's important about recognizing care partnerships when they occur is that it can be anyone with whom you share an important, mutually supportive relationship. What are the qualities that make for a very healthy partnership? Right? So I think it starts with effective communication, that people really need to be able to share thoughts, feelings, and ideas. They need to be able to listen and also communicate in ways that are effective. So that communication is key. But so are mutual respect and commitment. that in order for a partnership to feel satisfying, each partner needs to feel as though there is that ongoing mutual respect. A sharing of responsibilities, even if that sharing has to change over time because of MS symptoms or aging. That each person in the partnership cares for the other. This isn't a one-way street. We all have ways to give. And we also need to be flexible, either because of changes related to MS or to aging or life circumstances or crises like the one we're living in right now. Our partnerships need to be able to flex to meet the demands of whatever's going on in our lives. I want to start by talking more about this effective communication. I used to give a lot of talks about relationships and families, and communication was always a very significant part of it. And people started to say, okay, you talk about communication, it's important, but can you tell us how to do a better job of it? What do we need to be thinking about in order to communicate as clearly and effectively as possible? And I think it's always a good idea to remember that good communication actually starts with listening. So you want to listen so your partner will talk to you, and you want to talk so your partner will listen. So this was adapted from a wonderful book I read when my kids were younger, called How to Talk So Kids Will Listen and Listen So Kids Will Talk. But if we don't listen in a way that's open and accepting and loving, people who are important to us aren't as likely to talk, right? So we need to be thinking about how we listen with our body, with our ears. What messages are we conveying while we listen that will make others want to talk to us? We want to minimize distractions so that when we're listening, we're really listening intently and purposefully and not being distracted by our phones or the television or the kids in the background or anything else that might be going on. We need to pay attention to more than just words. Our body language says a lot when we're listening to somebody else. If we're rolling our eyes or looking at our cell phone or tapping our fingers or our toes, we're conveying a lot of impatience, we're conveying frustration, exasperation, and those body language signals can really shut a talker down. So we have to be mindful of what our body is saying while we're listening. It's also important not to interrupt or jump to conclusions. And sometimes if you are a listener or a partner for somebody who has MS, who's experiencing some cognitive changes, it may take them a little bit longer to organize their thoughts or put their sentences together or get to the point. And it's very tempting when you start to feel impatient to interrupt or to finish the sentence for somebody, to assume that you know where the person is going with what they're saying. But of course, when we interrupt, we actually disrupt communication, and we may be wrong when we jump to those conclusions. Talking, of course, is the other part of effective communication. And so when we are talking to each other, we have to avoid mixed messages. So again, don't say one thing with your mouth and another thing with your body language. If you're saying, I love you madly, sweetheart, or anything you want, I'm happy to help you, but you're actually watching a football game or a soap opera or paying attention to a task you're doing, what you're doing with your body is kind of contradicting what you're saying with your words. It's also important to be clear about what you need and what you don't need at any point in time. And this is true for both of you, but I'm going to focus for the moment on the person who's living with MS. Everybody's had the experience of feeling like symptoms are really active and it's a really bad day and you need a lot of help with things, and maybe that's on a Tuesday. And then on Wednesday, you're actually having a good day and you want to do things as much as you can on your own and you don't want people hovering over you. What you need to be sure about is that you're accurately conveying whatever you're feeling at a point in time. There isn't a support partner or care partner out there who hasn't had the experience of being told one day, stop hovering over me, I'm fine, I can do this by myself, stop treating me like a patient, I don't like all of this hovering. And then the very next day, being bawled out because they're not understanding that it's a bad day and that help is really needed. So it's really important to say this is a bad day and I could use your help with X, Y, or Z, or today's really pretty good and I'd like to try and do as much as I can on my own, but I will let you know if something comes up that I need help with. That way the messages are clear and support partners aren't getting confused or feeling like nothing they do is right. Also, when you're talking and listening, you want to allow the other person time to process what you've said and respond. So if you're talking along at a great clip and the person who's listening to you seems lost or baffled, or stuck, you really want to slow down your communication. You want to allow the other person time to think about what you've said and come up with their answer. Many people with MS will say to me, I was listening very carefully to what my husband was saying, but I was still back with the sentence that he started with, trying to think about how I wanted to respond, what I wanted to say, and he's 3 paragraphs ahead, and I'm lost. I just can't process fast enough to respond. So when you're talking, slow down, check and make sure that the person you're talking to has heard and understood what you said. And this message at the bottom is for all of us, all the time. No matter how much we love each other, we really can't read each other's minds. We may think we can, but we can't. So we need to be clear communicators. What I'm going to be talking about here is the ways in which mood and cognitive changes can interfere with good communication and with partnering. Depression is one of the most common symptoms of MS, and I say it this way on purpose, that with 50% of people experiencing depression in the MS world, that is way higher than the general population. And we know that that's because depression in people with MS is caused not just by the challenges of a chronic illness. Depression and other mood changes can also be caused by changes in the brain and in the immune system. So this is actually a symptom of the disease, just like a bladder problem or spasticity or pain or a walking problem. And we know from the caregiver literature, not just in MS, but across the board, that care partners are also at increased risk of depression for different reasons. So depression can really impact communication in a number of ways. It can create an emotional distance. People who are depressed are often turned inward, not feeling as connected to those around them, not able to communicate as well, so they feel apart, remote from one another. People who are depressed can feel isolated and helpless. And again, in a situation like you're living in today, where we're all sort of hunkered down in isolation and feeling a little more helpless than usual in regard to the world around us, that can exacerbate depression. And depression, interestingly, adds a lot to irritability. In fact, there was a very good study done quite a few years ago now by Sarah Minden, in which they showed that many people with MS actually present with irritability more so than the kind of stereotypical vision of a person who's depressed, under the covers, crying all the time. This irritability seems to be a very common presentation for somebody with MS who's depressed. And of course, irritability among all of us right now may be a little more active than it was before all this started. When people are depressed, that interferes with their ability to take care of themselves, but also their ability to care for each other. Depression is such a dark, heavy, painful emotional load that it just keeps us from that kind of care that we would give to ourselves or to others. And of course, depression can add to thoughts of harming oneself or harming other people. The good news is that depression is highly treatable. And effective treatment, we now know, starts with very early and ongoing screening. So we want to find people who are depressed and help them as quickly as possible so that their communication and their daily lives and their sense of well-being can get back to normal. Anxiety is another very common emotion in people with MS, and I can't say enough that all of us now are experiencing much higher levels of anxiety than is typical. So not just people with MS, but all of us are troubled by anxiety and the unpredictability of our current situation. But it's important for all of us to recognize that we as individuals experience anxiety differently. For some of us, it's sleeplessness, lying awake at night, ruminating about scary thoughts. For others, it increases irritability. We feel on edge. We feel kind of angry and edgy all the time, and that comes across to others as irritability. And I see I've got irritability twice on this slide, so perhaps I was feeling irritable myself when I did that. But this anxiety also results in some very different levels of risk tolerance. Now, what I mean by that is that each of us perceives risk differently, and we have different levels of the ability to tolerate risk. When we first started talking about this in the MS community, it had to do mostly with the benefits and risks associated with disease-modifying therapies, and we found in many families that partners differed in how much risk they were willing to accept related to a disease-modifying therapy, and they actually had to talk about their feelings of risk and what they were willing to risk and what they weren't willing to risk for themselves or their partners. So it can be health-related choices, but we can also be experiencing those different levels of risk tolerance now related to social distancing, for example. Within families, when you're trying to partner through this crisis, someone in the family might feel as though it's impossible to be too cautious, right? We're going to do every single possible thing we can to maintain social distance, to follow the rules, to not put ourselves or our families at risk. And for other family members, they don't feel quite as determined to follow every single rule every minute. And partners have to talk about this, and they have to come to some decisions that work for everybody. And we see this particularly between parents and maybe older children, teenage children, who may not be feeling quite the need for social distancing that their adult parents are feeling. Cognitive changes, which are also very common in MS, also impact communication. So whether it's related to MS or whether it's related to aging, cognitive changes have a significant impact on us, right? When we don't feel like we're thinking as rapidly or clearly as we used to, if it's harder to make decisions or harder to make plans and prioritize things, we don't feel good about that. It impacts our self-image, our self-esteem, our confidence. because our brains are so central to our sense of self, right? And when cognitive changes happen, if there's slowing of processing speed, if there's problems with memory or paying attention, that can really slow down communication and decision-making and problem-solving. So when partners are trying to work together to come to a decision or to solve a problem, then they may find that their communication is really impacted by these cognitive changes, and they have to talk about the changes, recognize them, and put into place some strategies to help them accommodate for the fact that there are some of these challenges going on. And cognitive changes, like the ones I've been talking about, are worsened by anxiety and depression. So the mood changes I talked about really intermingle with cognition. And so one of the things that as healthcare providers we want to do is recognize anxiety and depression as quickly as possible in people and get them treatment so that any impact they're having on cognition can be lessened. It's very important that we be patient with one another. And again, this is related to normal aging. It's related to symptoms of MS. But as partners, we have to remember that patience with one another is extremely important if we're going to be successful in our partnerships. So what does mutual respect and commitment come down to in a healthy partnership? I think we have to feel like we're loved. We have to feel that the other person respects us, appreciates us, whether we're a person with MS, whether we're a support partner, or whether we're not living with MS at all. And equally important, we need to feel safe in a relationship, and that's emotionally safe and physically safe. Mutual respect, it may seem obvious, but I think it really means this honoring of what you bring to the partnership. No matter who has MS and who doesn't, no matter who's living with disability or who's living with significant effects of aging, everybody is bringing something to the partnership that needs to be acknowledged, recognized, and appreciated. And everybody's feelings count. I do a lot of work with support partners in my work with MS, and one of the things I'm always struck by is that they feel, or they are led to feel by family members or friends, that their feelings should take second place, that the person with MS is the one everybody should be focusing on. And while, of course, that's important, support partners need to feel that their needs and feelings also count, that they are weighed equally. Because no one in a relationship wants to feel invisible or unheard. Commitment means having both feet planted in the relationship, right? That you don't have one foot out the door, that you are there to problem solve, to work together, and to commit your efforts to the partnership. Balance, which was the next feature of a healthy relationship I talked about, means that both partners are giving and receiving. Now, as somebody with MS experiences more symptoms or greater disability, that person may find that he or she is gradually giving over more tasks to the support partner. And the support partner, in turn, may feel like more and more things are landing on their plate. But we've got to make sure that people find ways to share in responsibilities, because when one person does all the giving and the other does all the receiving, neither partner feels good about it. Every person needs to feel like a respected contributor to the success of the relationship and the success of the household. So you may need to do some shifting. The person who used to deal with the finances may not be able to do that now, but may be able to take on more of other types of household chores. Or one may be responsible for making phone calls to schedule repairs and things like that, where somebody else is taking on more of the physical chores. Doesn't matter how you work out the sharing as long as each person feels valued. And by the same token, I think we sometimes forget to acknowledge and appreciate each other. I'm often saying to couples, have you taken time to pat each other on the back? Have you taken time to say thank you? Have you taken time to really call out when somebody has done something special for you? These things really help each person to feel valued. If you're trying to remember all of these things, I think there are 4 C's that really define caring for one another. And particularly in times of crisis like this, we all need gestures of concern, caring, connection, and commitment. It's kind of a checklist that I carry around with myself to make sure that I'm paying careful enough attention to my valued relationship. And remember that we care for each other in a lot of different ways. So in each of your partnerships, whether it's with a spouse, a close friend, a sibling, a colleague at work you're particularly close to, take time to talk together about the ways you try to care for each other. And if the gestures that you're trying to make aren't clear to your partner, or your partner doesn't seem to be recognizing them, you may want to try and do things a little differently. But it starts with the conversation. Also, I think partners really encourage each other's healthy behaviors. And this is true whether MS is in your life or it's not, whether you're a parent and child pair or spouses, whatever. Particularly now, we're trying to be as healthy as we can. We want to encourage each other's healthy behaviors, whether it's related to eating well, which is sometimes difficult in this crisis. I've heard many people say to me, every time I stand up in my house, I walk past the refrigerator and eat something. I get it. This is an anxious time and people are bored and feeling shut in, but try to remind each other that healthy snacks are better in the long run. We try to make time for physical activity. And we can encourage each other to stay active, whether it's with exercise or just daily physical activities, but we're up and moving around, particularly when we're now hunkered down at home. Time for laughter. We need to be able to enjoy positive things, funny things, things that give us pleasure. And we need to make sure that we're seeking out things that give us that kind of happy pleasure. And certainly time for gratitude, because even when things are very, very difficult, there's always something each day that we can be grateful for, and we can help our partners recognize those things we can be grateful for. And the last leg of this stool is flexibility. When MS changes one person's ability to do things that were done in the past, it's really important that the person with MS and the partner are willing to do new things or do old things in a different way. We have to think flexibly so that the world that we live in and enjoy doesn't gradually get smaller and smaller and smaller because our activities become more difficult. So one of the things I feel really strongly about and talk a lot about with families is that adaptive devices, mobility aids, equipment, these are tools for the whole family. They may be prescribed by a neurologist for the person with MS, but these are wonderful tools for the whole family because they allow for more shared activities. more ability to get out and do things together that are enjoyable, that are healthy, that are entertaining. We don't want to give up all those things that keep life full and busy and satisfying. Also, mobility aids can relieve the care partner of endless worries about safety, right? It's hard to enjoy being out for a walk with your loved one with MS if you're hyper-focused on, is the person going to fall? Is the person safe? Rather, if somebody is using a mobility aid or a motorized scooter, you can get out, you can enjoy the out of doors. The support partner gets a healthy run as he or she tries to keep up with the scooter, and you can actually go along together having a conversation and enjoying yourselves without having to worry about safety. And this is also a time when you can find new activities if the old ones that you loved really aren't possible anymore. So adaptive sports, and they come in all sizes and shapes, right? You can do almost anything in an adaptive way. But you have to be willing to try it. And I worked with a woman who was a very, very active skier, and her whole family was into skiing. Her husband, the 2 teenage kids, and they spent a lot of time together as a family on ski slopes. And her MS got in the way. And as a result, nobody really wanted to ski because mom couldn't do it and she would be upset. And so the whole family was kind of not doing something that they truly loved. And my client was unwilling to ski if she couldn't ski as well as she used to because she was really good at it. And then she decided bravely one day to try adaptive skiing, and she went to one of the adaptive ski programs on the East Coast and discovered that it felt great to be out on the slopes. It felt great to be able to ski using the adaptive equipment, and she was so good at it because she was a good skier that then she became able to help teach other people how to do skiing adaptively. And the result of all of that and her willingness to try something different was that the whole family got back into skiing and back into doing something that they love to do together. But there may also be hobbies or family activities you've never tried before, and the willingness to sit down and brainstorm about things you might want to try is part of being flexible in your partnerships. So here are some very practical tips to kind of send you on your way. You want to set time each day for uninterrupted conversation. That is particularly hard today where the whole family is together at home for very long periods of time. But it doesn't have to be very long. Just a few minutes with your partner to have a conversation about how you're feeling, how it's going. Identify out loud your individual and shared priorities. Take turns, then figure out what are your shared priorities for the day, for the week, for the family, and plan how best to address them. Make use of available resources. There is no reason why you have to do all this alone. All of the MS advocacy organizations are there to help. Please keep an eye on each other's moods, right? And any person can request a depression screening. So a person with MS can speak to his or her neurologist and request a screening for depression or anxiety, or your primary care provider. But also, I want you all to know about Mental Health America. They have an online screening site which gives you free, confidential screening using validated measures for a whole variety of emotional issues, anxiety, depression, and others. and you take the online screening. Nobody knows it. Nobody sees it. They give you a printout of your score, and then depending on what you see in your score, you can take it to your healthcare provider and say, I did this screening, and it looks like I'm maybe very depressed or I may be anxious, and can you help refer me to somebody? And most of all, remember that depression and anxiety, which can have such an impact on your partnership, are not signs of weakness at all. And when you address them, when you take the bull by the horns and get the screening and get the help, that's a real sign of strength. And it's not only good for you, it's excellent for your partnership. A couple more tips. The National MS Society's MS Navigators, some of you may be familiar with them, but they are trained social workers and counselors, and they're available at this number on the screen. And you can call them for information, for local referrals, for a variety of resources. But they also have a crisis team in place to help individuals and families in crisis. So if you feel like you're sort of reaching your limit, or even over the top, and things are not going the way they need to go right now, and you need some help, please reach out to them. They do a wonderful job, and you won't be feeling as though you have to do this alone. And if either of you in your partnership is behaving in ways that you're not proud of, or you wouldn't want anybody else to see, that's not a sign you're a bad person. That's a sign of being overwhelmed. It's a real red flag that you are stressed beyond your capacity. It can happen to anybody. So if that's happening, please reach out to one of the navigators and just let them know that you're feeling overwhelmed and really, really need some help. Here's a little exercise that I want you to try at home. This is actually very helpful, and we've seen people do this in groups and then share in large groups of people. But I want you to try this individually, and then I want you to share your responses with your partner. So each of you takes a piece of paper and you draw a circle that represents your life pie. Okay? And then without talking to each other or looking at each other's paper, color in a segment that shows how much of your life is taken up by MS. And then when you compare, you may have some surprises. You may discover that your slices are exactly the same size, or you may discover that they're quite different. And one of the situations that really hit home, it was quite interesting. This the couple at this program that I was at did this exercise, and then they shared their experience with the group. And the woman was the person living with MS, and she said that she was always so worried that her MS was just ruining her husband's life, that it was taking over everything. And she was so surprised that when they compared their pie drawings, that her slice of the pie was large, but his was quite small. And she said, really? Really? And he assured her that this was an honest answer and that he didn't feel her MS was taking over. And it started a wonderful conversation for them. So I would suggest you try this and try it periodically and talk about what you might want to do. I'm sorry, if MS is taking over. And then I would suggest right now that you do the same thing around COVID-19. Is it taking over? Is it taking up too much of your emotional space, too much of your time, too much of your thinking? And if it is, what can you work out together to find some other activities, some other things to do and enjoy to take your minds off this current crisis? If you find that MS or COVID are taking over, These are some suggestions for what you can do for relief or distraction or comfort. We are all using virtual ways to connect, and it's been wonderful. We're doing some connecting much more with important other people than we did before the crisis. But enjoy a good book, a movie, a piece of music, whatever gives you joy or pleasure. Try creating something yourself that's beautiful or funny or calming. Share laughter. Enjoy something beautiful, a view, a piece of art, a familiar face. Or engage in a spiritual practice that helps you connect to something beyond yourself. Whatever you do, it doesn't matter as long as you are doing something to fuel your emotional self, because that's what you need to continue meeting day-to-day challenges, whether they're related to MS or anything else that's going on. If you are feeling all alone, if you don't feel as though you're having enough support and connection with other people, you're living alone in this isolated time, take steps to connect in whatever ways you can. My mother used to say this, it only takes one good friend, and I really believe this. I moved around a lot, and finding the one good friend got me through whatever new situation I was in. So online chat rooms, MS advocacy groups, calling that MS Navigator I talked about, joining an online class, of which there are many now, and they're blossoming because of the COVID crisis. Volunteer for a political campaign, phone bank, to connect with other people. Find a way to help somebody else virtually. All of these things will help you feel connected and supported during this difficult time. And the next slide has some helpful resources, so I'm hoping this will be recorded so that you can find these. But I just want to call out the Can Do MS and the National MS Society partner on webinars, and there are many webinars related to the topic that I was talking about today.
That's all the time we have for now. If you missed any part of this teleconference, they'll be replayed on msfocusradio.org and available on demand. Follow MS Focus on Facebook, Twitter, and Instagram for times and access information. To all of our callers for your participation, and especially to Dr. Rosalind Kalb, thank you so much for your time that you spent to prepare and share this information with us.
And thank you, Chris. It was a pleasure to be here, and I hope everybody can stay healthy and well and enjoy your partnership.